The Plague Doctor, the 17th century. In Italy, 1656 through 57, devastating outbreaks of bubonic plague in Naples, Rome, and Genoa killed approximately 200 to 400,000 people. It's unknown where this deadly plague originated, but it's said to have spread from Naples, where restrictions and precautions were non-existent. In these cities, plague doctors were hired to treat plague patients, especially for the poor who could not afford treatment. The doctor's costume was designed to protect them from what was thought of as evil smells or bad air, which was seen as the cause of infection at the time. This is now known as the medically obsolete miasma theory. In reality, the plague was caused by the bacterium Yersinia pestis, which exists in fleas found on rats. The infected would have flu symptoms followed by swollen and painful lymph nodes, gangrene, and vomiting of blood, with death following within a week from infection. Some historians point to Charles Delorme as the inventor of the costume, which was modeled after soldiers' armor. The most striking feature was a birdbeak-like mask with crystal glasses. The mask was more than aesthetic and acted as a respirator filled with dried flowers or spices, which the doctor breathed through, protecting them from contagions. The doctor would also wear a long Moroccan leather gown that tucked into the mask to prevent contact with the patient, and the surface was waxed to prevent miasmas sticking to the surface. The doctor would also wear gloves, boots, and a wide-brimmed hat to show his profession, and hold a wand or cane to examine and issue instruction without touching the patient. Methods of treatment for the miasma, which was really the plague, were ineffective. Remedies included bloodletting and the use of leeches on the affected areas. Prescriptions of toads or spiders were also given to absorb the bad air. The plague doctor's appearance was quite terrifying for patients, as it was a sign of impending death, and they were kept out of the way of the public due to the nature of their profession.